Neck cancer could happen to you. That's the message from Ironwood Cancer and Research Centers. Joining us today to talk about the importance of regular screenings are medical oncologist Dr. Syed Akbar and radiation oncologist Dr. Ammoren Dohm. Thank you both for joining me this morning.
Thank you, Daryl, for having us here.
So what is head and neck cancer and how common is it?
So head and neck cancer encompasses a variety of cancers that can start in your mouth, your throat, tongue, nasal cavities, and sinuses. And it's a cancer of the lining of these areas. In terms of how common this cancer is, it's about 4% of the total cancer we see across other types of cancers. And within the United States, annually we see about 70,000 new cases and almost 16,000 deaths as a result of it.
And what are the causes and symptoms of this cancer, and how important is early detection?
So in terms of causes, historically, alcohol and tobacco use have been the leading causes of this type of cancer, although lately HPV, which is a sexually transmitted infection, has become a leading cause of causing this type of cancer. Other causes include, which are not as common, are weakened immune system, sometimes exposure to certain chemicals, are other less known causes. Symptoms are vague, and commonly what we see is persistent throat pain, difficulty swallowing, hoarseness of the voice, a lump in the neck that's not going away, or a sore that's not healing. Whenever you see these symptoms, it's always good to get it checked out as soon as possible, because early detection and diagnosis is key. The diagnosis typically involves a biopsy of any suspicious area. If we catch it early, the chances of curing it are the highest. Prevention strategies that you mentioned that we can think, of course, quitting tobacco use, cutting back on alcohol are, the big things we stress about. I would also like to mention the importance of HPV vaccine, which is a vaccine that is approved in the United States, and it does offer protection against some strains of the virus which are known to be associated with this type of cancer.
And Dr. Ammoren, can radiation therapy be used as a curative option?
That's a great question. So radiation therapy involves the use of high energy beams like X-rays to kill or stop the growth of cancer cells. So radiation alone, or often in combination with chemotherapy, can be used as a curative option for several head and neck cancers without the need for surgery. This can be a particularly beneficial approach in certain head and neck cancers, for instance, vocal cord cancers, where preservation of voice quality is crucial. So there are several technological advancements, such as image-guided radiation therapy or intensity-modulated radiation therapy, that allow us to deliver these treatments with pinpoint accuracy. These technologies allow us to tailor our radiation treatments to the exact shape and location of the tumor, and thereby salvage surrounding healthy tissue.
And let's talk a little bit about the multidisciplinary treatment that you guys offer.
Yeah, at Ironwood, we care about treating the whole patient, which means we take a multidisciplinary approach. So radiation therapy is integrated with other therapies and services such as imaging, chemotherapy, immunotherapy, targeted therapy, and we offer that all under one roof for patients' convenience. Our robust care team also has other services such as registered nutritionists and social workers to provide for patients' psychological and nutritional needs. Additionally, we provide access to several clinical trials. We also have access to additional therapies such as massage therapy, acupuncture, or aromatherapy. And we also have several classes and support groups for patients and their families to ensure a comprehensive approach every step of the way.
Dr. Syed, Dr. Ammoren, thank you so much for joining me this morning to talk about the importance of this cancer and how people can reach out and get the help that they need.
Thank you for having us.
Thank you.
If you guys would like to learn more information, you can go to their website or call the number you see on your screen.